Hello, I'm James Andrews, reporter with Food Safety News. I'm here at Food Safety Summit 2015 in Baltimore, Maryland, and with me I have Sarah Schacht. Sarah, you are an open government consultant, and you've got a pretty interesting story. You're now working in the world of big data, trying to help governments and restaurants be a little bit more transparent about their public health records. And so we've covered a few stories on what you're doing, and could you tell me a little bit about how you got started with all this, with the foodborne illness outbreaks that you were a little too personally involved with?
Sure. So I was a survivor of both the Jack in the Box E. coli outbreak 20 some years ago. And then 2 years ago, I was in a second E. coli outbreak with a small Seattle area restaurant that was serving up E. coli for over a month that we know about. And so my second experience with E. coli was actually more severe than my first. It was a pretty terrible health experience, and I've been permanently impacted with my health and kind of I guess, the way I'm able to go about living my life because of after effects from the second round of E. coli. But because, in between E. coli outbreaks, I've been an open government advisor and consultant. I ran a nonprofit organization. I've worked with governments all around the world. And so I ended up diving into, once King County, Washington, and the state of Washington had confirmed what restaurant I got sick from, I dove into their restaurant inspection scores and found that they were buried on a website that was difficult to search, that hadn't been redesigned since 2002, and that there was a scoring system that most members of the public couldn't interpret. And so I realized that this, along with just restaurant inspection scores not being posted on restaurants and not being made available through third parties like Yelp or other restaurant review sites, it created a barrier between the public and those scores that governments are already invested in compiling. And I wanted those scores to be more public and available. And I've been a fairly successful advocate in getting those scores more available to the public.
And you're now working with King County, that's the county in Seattle, to improve their restaurant placarding system and, make information more available to the public about restaurants that have had problems in the past. Can you tell me exactly what the process is like? Like, what stage in the process are you in helping bring a new restaurant placarding system to King County?
Sure. So after consideration, King County, within a year of my advocacy, agreed to posted restaurant inspection placards, posting their scores on Yelp, revising their website, and they're even considering their own mobile app to make it more mobile friendly to review scores. And I was invited to be a part as kind of a citizen advocate, to be a part of a stakeholders committee. We had two committees, one on risk classification and another one on the restaurant inspection scoring system, which included placard options. And so we were in a 6-month process. I was the only member of the public who wasn't an academic or an epidemiologist there. It was mostly restaurants as stakeholders. And we dove into various scoring systems around the world and developing a model that we thought would work both for restaurants and consumers and for the public health community. And so King County hasn't announced yet exactly what that will be. And I've been trying to kind of push for more transparency around, well, what's your decision-making process looking like right now? However, to help kind of bring more public engagement to that design process, I thought it was important to not just have me at the table, but to do usability studies of restaurant inspection score placards. So I crowdfunded an effort to do a usability study. I recruited graduate students and qualified undergrads from University of Washington's Human Centered Design program. They did a comprehensive usability study with the help of Susie Craig from WSU. She's an epidemiologist. And we released the report last month. That's influenced the design as well. And so we're just kind of waiting to hear back what that final design is going to look like. I am hopeful that it's going to be a 0 to 5 score or a 1 to 5 score, where what the committee suggested was we have 3 as meets expectations, So that would be the equivalent of, say, a New York A or a San Francisco A. And then a 4 and a 5 would actually be markers for excellence. So we would offer both a carrot and a stick model to restaurants, where if they're consistent, if they're showing progress, if they're investing in training or technologies for food safety, they get rewarded in the displays of restaurant inspection scores presented. I'm also hopeful that we will have scores that not just present the current score. In fact, King County is leaning towards an average of scores, which in the usability study we found consumers, it had a bit of a cognitive load, and consumers didn't really understand why they would see an average. They wanted to see most recent. However, I'm hoping that we will see an average score and an inset of the ups and downs of scoring. Yeah.
And you're now working with a data software company, Socrata.
Yeah.
So congratulations on that. But can you tell me what you're doing with Socrata and how you envision the use of data and information improving public health?
Yeah. So, I've worked in the field of open government, which has included open data for over a decade. And we've seen in various parts of government where open data has really improved either processes for government, it's helped them kind of streamline and share data, and it's also helped the public gain a broader understanding of how things in government are working, or everything from like the GIS locations of parks to budget information. It's all over. So some municipalities have restaurant inspection scores in open data. And Socrata is an open data company, so many of our customers are actually here at the conference. Their municipality is already, using Socrata to open up its data, but they may not be putting their restaurant inspection scores out in open data. And what we are trying to do, in my project I'm really lucky to work on with Socrata, is to basically help government stand up their restaurant inspection scores, and to get a second set of data where we take those inspection scores and put them in the live standard format for inspection data. So the value of their scores is equivalent. It's just a standard format for scores. So across municipalities, you can compare, you can travel and understand, well, a 96 means a 96. Whereas in King County right now, a 96 doesn't mean 96 out of 100. It means 0 is the perfect score and 96 is terrible. And so consistency and usability is key. And so once that data is up and open and standardized, third parties like Yelp, like Urban Spoon, even the app developer down the street from your municipal government, they can use that data and create tools that give your data much broader audience and get it in front of consumers. And I feel like, in governments, everybody feels like they've got too few hands to do too much work. And it's really amazing to me that we can take this data and put it out there where there's going to be far more access, where that information can be doing your work for you, and hopefully having similar effect to posted restaurant inspection placards, where we tend to see over time posted scores usually bringing down total foodborne illness incidences. So my hope is that we can study this as well as, pilot putting restaurant inspection data out in a standard format and getting it up in consumer-facing sites. So it gets more legs than just sitting on your website somewhere. Yeah.
Well, Sarah, I really appreciate everything you're doing, and I really appreciate you taking some time to speak with us today.
Yeah, thanks for having me.
Thank you.